Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Welcome to Heart of Health Live. I'm Dr. James Marcum, and with me tonight that's going to be helping me is Michelle Chinn. She's a nurse practitioner that's working on her doctorate degree, and before we came on air, she was telling me all the things that she's going to have to do to get that doctorate. And I'm glad I don't have to write that big paper and do all that work. I'm sort of glad that's behind me. So we're going to keep up with Michelle because she's going to co-host this program on occasion. She's given her time to us. And tonight we're going to be talking about cardiovascular disease, something that many Americans have. It's one of the leading causes of death both in the United States and worldwide. And if you want to call in right now, you can get your question. We're going to try to answer just about everything tonight. Our phone number is 855-644-3278. If you just want to go on the computer, you can do heartwiseministries.org. That's our website, and you can get a hold of it that way. Or we have a new technology tonight, and that's texting. And some people are out there that know how to text. If you want to text us, our text number is 423-834-7307. And one of the people that text in tonight, we're going to give them this book, The Ultimate Prescription for Trying Our New Technology. We'd also like you, if you're interested, to be one of our Facebook friends. The Facebook world continues to grow. You can be one of our Facebook friends. I just want to thank everyone out there for being a part of Heart of Health Live, and more than that, for praying for each other. As we pray for each other, God can enter lives in many different and exciting ways, so we want to thank you for that. And tonight, as we answer questions, we want each one to feel like they're part of the family. Give us a call, 855-644-3278, and we're going to be answering your questions. And we want to particularly answer questions that have to do about cardiovascular disease. That would be heart, blood pressure, rhythms, stroke. So we're going to be right back after the break, and Michelle and I are going to be talking to you. So give us a call. If you're calling now, you can be one of the first ones online tonight. So stay with us. We're going to be right back.
The Heart of Health Live will return in just a moment.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Would you like to experience better physical and mental health? Then consider volunteering in your community. Studies have shown that youth who give of their time to help others perform better in school, have greater self-confidence, and are more likely to become leaders in society than those who do not. And amongst adults, those who volunteer experience better physical and mental health, lower rates of disability while maintaining their autonomy as they age. And amazingly, these benefits persisted even after taking into account baseline limitations, socioeconomic status, health status, employment, exercise, smoking, and marital status. When we volunteer to help others, we activate the brain's love circuits, which calm the brain's fear circuits, reducing inflammation, thereby reducing physical and mental illness. To be smart requires a healthy brain, so be smart, live to give.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Hello, I'd like to welcome you back to our program tonight at Heart of Health Live. We have Dr. Marcum, who's actually being our guest this evening. And our topic for you this evening is cardiovascular disease. I know they just told you, but I'm going to tell you that number again where you can reach us at 855-644-3278 if you want to call us. And again, if you want to text us, just as Dr. Marcum was saying, 423-834-7307. And Dr. Marcum, one of the things we get asked a lot is, how do you know if you have heart disease? What are the symptoms?
That's a great question, Michelle, and I hope, are you feeling pretty normal tonight?
So far, so good.
Okay. Well, I tell people anything that you do that we would consider abnormal could be considered a symptom. It doesn't happen in a normal day. For cardiovascular disease, for instance, anything above the waist I've seen could be related to cardiovascular symptoms. Sometimes people have chest pressure, sometimes pain, sometimes it migrates to the neck, the arms, the left or the right. I've seen it only present as pain in the back. In women, sometimes they just feel fatigued or short of breath or a stomach ache. So any symptom that's abnormal, that's prolonged in nature, there's always a chance it could be your heart. Now, another symptom that comes on that could be related to heart is if you're doing something. You know, the heart becomes, when it works hard, that's when it has to have a symptom. And that's the whole basis behind a stress test. Let's say you're walking up a hill and you feel a tight, funny feeling, and you stop and it goes away. Well, that could be a sign that you have coronary artery disease. And so that would be a symptom when you're doing things. Some people just get extremely short of breath. Some people get dizzy and pass out. That usually is a sign that there's not enough blood going to the head. Your blood pressure goes low, you feel dizzy, you pass out. That could be a cardiovascular symptom. Some people feel like they can't breathe, they're suffocating. That could be a cardiovascular symptom. So I don't know if you've experienced women before with cardiovascular disease, but they come up with much different symptoms, and there's been many different mechanisms explained for that. One of the mechanisms people say is, oh, women have smaller blood vessels. They have microvascular disease. Another mechanism that's been proposed is it's a hormonal thing. You know, women have different hormone, different pain receptors. So a woman might present very much differently than a man. But in general, men tend to have cardiovascular disease about 10 years before women on average because of this estrogen protective effect. So about 10 years after menopause is usually when we see the most symptoms. I had a lady that came in the other day that her only symptom, now she was 85 years old, her only symptom was complete exhaustion. She just felt extremely, extremely tired. She never had that feeling before. Well, guess what? We checked for cardiovascular disease, and lo and behold, she had cardiovascular disease. So any abnormal feeling, usually above the waist, that you can't explain, there's a chance it could be cardiovascular disease. Now, what I do is it's cardiovascular disease until I prove it's something else. For instance, if I touch it here and it hurts, I know that's not cardiovascular disease. If I can explain it by something else for sure, then I know it's not cardiovascular disease. So as a cardiologist, I assume it's cardiovascular disease until I can prove it's something else.
Now, how long would you have to have any one of those symptoms you described? If I had a shoulder ache or a backache, would I have to have that for several times?
Yeah.
Should I come see my doctor if I get it just once? How am I going to know? When do I go and get help?
Well, that's a good question. One thing that I said, if you can cause a pain to happen on exertion, okay, that's a sign that something's wrong. You need to either cut back your exertion and plan a doctor's visit. But any symptom that does not go away, that's ongoing, let's say you have a burning in the stomach and you think it's reflux, but if it doesn't go away for a prolonged period of time, that's either a heart attack or something else. Pain in the shoulder that migrates to a neck that will not go away, that's either a heart attack or something else. pain in the back that won't go away, but you touch it and you can reproduce it. Well, that's probably a muscle.
Good to know.
But
Good to know.
shortness of breath that will not go away. You can't breathe and smothering. Well, in my opinion, it's either heart attack or something else. The way we, of course, tell if you're a heart attack is get help immediately. If we can get someone help pretty quickly, we can do very successful. We usually have about a window of about 6 hours to get help. If you're having a heart attack, you could have a dangerous heart rhythm. The valves could go problem. So it's very important to identify a heart attack early. We do this by having a patient go to the hospital, not a doctor's office. That takes time. You go to the doctor's office and they're just going to send you to the hospital. But what we do is we do an EKG. Sometimes that lets us know. We do blood work that can signify a heart attack. Sometimes that helps us. Sometimes we have to do further diagnostic testing. So those are all the things that we need to go. And you know what?
What?
We have a phone caller named Lillian. Lillian, you're on Heart of Health Live. Go ahead with your question, Lillian.
Okay, thank you. I want to know if there's supplements that you could take for hypertension so that I wouldn't have to be on prescription medicines.
Okay. You know, I get that question a lot.
Very common.
Now, high blood pressure just means the blood pressure's high. So, Lillian, the first thing I would want to know, you know, everyone wants to take an herb or supplement, but I want to look at, I think of it, the herbs and supplements very similar to medicines. They all change our chemistry. But what I would want to know first is what's causing the blood pressure. Because if you can get at the cause, maybe you can get at the blood pressure problem without taking anything. Some people have it because they carry extra weight. Some people have it because they eat too much salt in their diet or processed foods. Some people get it because they don't exercise. Some people can be thyroid disease or kidney disease or adrenal problems. Some people get it because they have a sleep apnea. So after you've gone down this entire list, if it's not a observable cause, the next thing I tell people, well, what are things naturally you can do to lower blood pressure?
Right.
Okay. One of the ways, the best natural thing you can do for the lower blood pressure is exercise. So you want to get on an exercise. Lillian, you exercising?
No.
Okay, well that's one thing that might help. Get on an exercise program, start out slow, build yourself up. Other things, you know, everyone wants, is there any herb that lowers it consistently? Not that I know of, okay? We do know that there's things like garlic that's been shown in some studies to lower blood pressure. But if you compared garlic with exercise, exercise would win all the time. We know that people that are hydrated better tend to have lower blood pressures. We know that people that eat a plant-based diet tend to have lower blood pressures. We know that people that eat a lot of fatty foods, it tends to constrict the blood pressure and that raises it. Also, there's a substance, the endothelium, which helps the blood vessel dilate, is healthier in people that eat plant-based diet. So I try to get a person to eat lots of fresh fruits, vegetables, nuts and grains, omega-3 fatty acids, an exercise program, lots of water. And if then that doesn't work after all of that, then I would say, well, you might want to add something like garlic on. But if that didn't work, then there is a place for modern medicine. And you might want to talk to your doctor about the medicine that's the least amount of side effects. Some people, believe it or not, Michelle, have high blood pressure no matter what they do.
They do. Some people do.
And some people do benefit from taking a medication. So Lillian, I hope that, you know, but it sounds like you can do the walking part. Are you drinking enough water, Lillian?
I do.
Okay. Do you eat a pretty healthy diet? Lots of fruits, vegetables, nuts, and grains?
Yes.
Okay. And what has your blood pressure been running?
Like 148 over 85.
Okay. So that is sort of a borderline blood pressure. So what I would do is I would make sure you take the blood pressure at home when you're nice and relaxed, start an exercise program, see what the trend does, and see if your doctor thinks it's something that can continue to be just watched or something else might need to be done. But thank you for your call, Lillian. Appreciate it.
Thank you.
All good words. Thank you, Dr. Marcum. And we're going to take just a little bit of a pause here. I want to give you that phone number one more time just so you have it. That's 855-644-3278. And we are doing a new thing tonight, and that is texting in. And the text number is 423-834-7307. And we'll be right back for more of your questions.
Heart of Health Live will return in just a moment.
Heartwise Ministries, and these adorable sheep. Want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Thank you. Welcome back. We're so happy to have you with us tonight, and our special guest is Dr. Marcum himself, and we're talking tonight about cardiology, and we're here to answer your questions. We have a call now from Michael. Michael, you're on the air with Dr. Marcum. What is your question for us tonight?
My question, Dr. Marcum, is my wife's got a clogged artery on one side of her neck, and is that LDL or is it HDL and LDL?
Oh, okay, well that's a great question, Michael. And what I'm going to do is, you probably won't be able to see this too well, but this is a picture of a cross-section of an artery. And this artery right here has no blockages in it at all, okay? And this blockage here has lots of blockages in it, okay? And that's where we have clogged up. And what is it, okay? Well, it's a combination, it's a combination of many things that make up a plaque. That includes LDL cholesterol, lipoproteins, it's a fibrin mesh, lots of different components make it up. But the big component I want you to remember tonight is this word lipids. Lipids are fats. Fats are the bad component that makes up one of these things. It clogs up the endothelium. So we use a measurement of lipids in the body is this thing called LDL. We call that low density lipoprotein. So this is a type of lipoprotein. There's also something called high density lipoprotein. There's other substances called chylomicrons. There's other substances called triglycerides. There's many different substances that have to do with fat that run around in our body. They sometimes get organized and cause this plaque buildup. In your wife's situation, if it's causing symptoms in the neck or greater than 75% blockages, your doctor will probably want to talk to you about doing a procedure to help lower the risk of having stroke. Some natural things that you can do are things like diet and exercise, keeping the blood pressure good, taking some blood thinners, and maybe even taking a cholesterol-lowering pill if she can have it. So I hope that answers your questions a little bit, Mike, and thanks for calling us.
Thank you, Michael.
Thank you very much.
Thank you. Our next question for our next caller, Katie. You're on the line with Dr. Marcum. What's your question?
Hello.
Hey, Katie. Go ahead.
Hi. My question is psychological drugs hard on your heart?
What did she say?
One more time, just back up. Just what was is what hard on your heart? That one key word you kind of broke up there a little bit.
Is psychological drugs hard on your heart?
Psychological drugs. Yeah.
Got it.
That's a good. Well, you know, the ones that cause the problems usually cause rhythm problems. Okay, and there's certain medications that you do have to be careful with. Most of them that I know of do not make your heart weaker, but many of them can interact with other medicines, and some can cause this rhythm to get longer. There's a rhythm part of your heart, we call that a QT interval, and sometimes this interval can be prolonged by taking certain psychiatric medicines. So what you want to do is you want to ask your doctor whether this medicine that you're taking or someone might be taking affects the rhythm of the heart. Most of the newer ones do not affect the heart at all. The ones that did affect the heart were some of the older ones that were out there. We're not using many of them as much. But anytime you have many drugs interacting, it could affect different things on this rhythm. So that's a good question to ask your doctor, Katie, and we want to thank you for calling us, okay?
Thank you, Katie.
Thank you.
Thanks.
We have someone who's actually texted us in. We were talking about that earlier. And the question for you, Dr. Marcum, this individual is a young person, only 20 years old, had pain for a long time in the chest, and they're just not sure what to think of that.
Okay. Lots of people have chest pain. And the way I would approach this if they came to my office is first I would get some information, you know, and I'd see if like we talked about earlier, if the pain happens when it's touched, it's probably not the heart. If it happens when you breathe, that goes with muscles. If it happens after you eat, that usually goes with GI tract. If the pain only happens when they do something and goes away when they rest, that could be the heart. In a younger person that's not had heart problems, that don't have risk factors like diabetes, high blood pressure, high cholesterol, that probably is not the heart. One of the most common causes I see in young people with chest pain is actually muscles. And what happens is, believe it or not, we live in a stressful world. Do you ever get stressed?
Once in a while.
Yeah,
I try and avoid it if I can.
Everyone gets stressed sometime. And when our bodies are under stress, the body wants to fight. We want to fight something off. You know, we want to fight. And when we fight, our muscles get ready for battle. You know, if you had a cramp in your leg, if that muscle got tight, you wouldn't think much about it. But if a muscle gets tight in the head and causes a tension headache, you know, that's one thing. But if it happens in your chest, oh my, that's where my heart is. Right. One of the most common pains that people have that are younger are the muscles getting tight, and that could just be caused by too much stress. So one of the things you want to make sure you do is go to your doctor, have them investigated all the different causes, and have them talk to you, because that's, in a young person, that's where I'm going to learn the most, is by getting a good history. Now, have you had this pain for a long, long time?
This is someone who texted.
Texted me. They're going to have to text us back.
They're going to have to text us back with the answer to that.
I am glad you're here letting me know that.
Yeah.
So, now,
that's a text.
We're giving something out to one of our texters tonight.
We are. We are giving out Dr. Marcum's book, The Ultimate Prescription. So text your messages in. Again, that number, because it's new, that number for you is 423-834-7307. Thank you.
That was a good question.
We touched on prior to our last break on blood pressure, what can lower it naturally. We have another question on blood pressure. What is the right blood pressure? Yeah, when is it too high? When is it not too high?
And a lot of people don't know it. Blood pressure is the pressure in the system that the heart generates. And the blood vessels carry the pressure. And if it gets high blood pressure, what happens is the blood pressure actually damages this inside lining called the endothelium. And it can damage it all over the body. It can damage it in the brain, precipitate strokes, in the heart, cardiovascular disease, in the aorta, cause aneurysms. So it can be a damage. Sometimes it's called the silent killer.
Yes,
because people don't even know they have it. So everyone needs to get your blood pressure checked. So you go to the doctor or the drugstore and you have a device that usually goes around the forearm. That's usually the best. It blows up and it measures the pressure, and usually they listen to it with a stethoscope. If the top number consistently goes over 140, and the bottom number consistently goes over 90. The top number is called the systolic blood pressure. That's the pressure when the heart pumps. The diastolic pressure is the pressure when the heart relaxes. If that number is consistently up, there's a sign that you might have high blood pressure. But a lot of people, it goes up in the office.
Yes, it does. White coat syndrome, like that coat you're wearing right
there.
there.
So what I tell people is take your blood pressure when you're nice and relaxed at home. Take 5 or 10 deep breaths slowly. Put an adequate cuff around your arm and take it. Now, sometimes people use these the wrist cuffs. They usually read a little bit high. So if your wrist cuff pressure is normal, then it's probably a pretty good pressure. But that's a great question, because lots of people, if they find out that their blood pressure is high, they might say, hey, I better do something now so I don't go 20 years with high blood pressure and have damage to one of my blood vessels. So that's a very important question. So I would start out 140 over 90 in a normal person. If you have diabetes or vascular disease, we try to keep it a little bit lower. And people that have heart disease, you know, the heart doesn't want to pump against all that pressure. It's like pushing over and over, and sooner or later what happens, the heart gets all big and thick, and then it wears out. So if you have heart disease, we want to even keep it lower. That's a great question. It
is a very good question, and that's a question I know that a lot of people have across the board. We're going to take a break here again, but again, we'd like to just share with you our phone number, 855-644-3278, and our text messaging, 423-834-7307. We're going to be right back, ready to take your questions for Dr. Marcum on cardiovascular disease.
The Heart of Health Live will return in just a moment.
Could It Be This Simple changed my life. What an amazing and solid yet fulfilling and liberating message Dr. Jennings provides. I loved it.
It is liberating. It frees your mind from all your mental turmoil and teaches you what is really going on.
This book is amazing and makes so much sense. It shows God as a God of love rather than an arbitrary, exacting God.
I am so grateful that a friend suggested I read Could It Be This Simple? It has helped me fine-tune my thinking.
This book not only helps the mind to heal, but helps to liberate the emotions by bringing them into balance. You will be captivated with the case studies liberally sprinkled throughout this small, easy-to-read book. I dare you to read it.
Get your copy of Could It Be This Simple? A biblical model for healing the mind at Amazon.com or wherever books are sold.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Hi, I'm Dr. James Marcum, Speaker, Director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. It's good to have you with us tonight. We have Dr. Marcum here as our guest, and he's talking about cardiology all the way from prevention to signs and symptoms to what do you do if you really do have one of those problems. We have a caller on the line now. Pam, you have a question for Dr. Marcum. What's your question?
Yes. My husband just had some tests done on his heart. I wrote this down because I was afraid I'd forget it. His two main valves in his heart are leaking blood into his heart. She said it was 10 drops of blood every heartbeat. And she said the heart is sick. His heart doesn't relax as good as it should. When your heart beats, the valves are supposed to heal themselves up until the next heartbeat. My husband's aren't. So it leaks into his heart. And I was told it leaked into his heart, into his lungs, and back into his arteries. His heart gets tired, he told me, and it feels like it's going to stop beating. Will the bleeding stop if you keep your blood pressure under control? That's one question. And will the leaking get worse? And I had two more questions. Can this kill him? The doctor said it wasn't serious and said it was just a trace. So my first question, let's see where I wrote that.
Sounds to me, Pam, like your first question is, will controlling his blood pressure control the leaking valves? Is that pretty much sum that up for you?
Well, I had a couple more questions. I want to know if it's going to kill him, if it's serious.
Right. Pam, let's go ahead and start with that first question. We'll let Dr. Marcum answer that for you.
Pam, of course, without having the picture, the sound wave picture to look at, I can only speculate and talk in generalities. But usually, if you lower your blood pressure, that will help it not leak as much. The key thing you want to understand right now is why the valve is actually leaking. 10 to 20% of people can have normal leaks of the valve. If the valve has been damaged by an infection, by calcium or infections, if people have had heart attacks, those are usually a more serious problem. If the person gets short of breath when they do things, that's a common symptom of a valve leaking. So usually, if it's just a little leak, it does not kill a person. We monitor it by echocardiogram. The old-fashioned way is just listening to the heart, asking the patient whether they can walk well and breathe well. If a patient can walk well and breathe well and there's not a significant problem, usually I just say watch your blood pressure, get on an exercise program. Try not to let it stress you out and too worry about it, because if you're stressed out too much, then your blood pressure is going to go up and it's going to leak more. So it sounds like from just talking to you that this is a minor problem. It's not a big deal. Your doctor will keep track of it. If he thinks it's a big deal, he might order a sound wave test again in the near future. And we want to let you know, Pam, that one of the most important things is healing, is to understand that there's a God that wants to be part of every part of your life. Just keep him involved in your life, and he's going to see you through this. And try, a lot of people worry so much about their health. Try to give it to God, to trust in him, and get as much information as you can, and don't let it sort of dominate your life.
Thank you. Thank you,
Thanks
Pam,
for
calling. Clara May and Arthur, you're on the line with Dr. Marcum. What's your question?
Yes. My husband, Arthur, had a major heart attack in 1997, and he had double bypass surgery. And then again in 2010, he had a little left, well, it was a serious, heart attacks are always serious, but he only had 2 stents put in this time. And the stents that were put in were cobalt chromium covered. And we have heard that stents can cause a problem with later on causing things to like clots and so forth that come from damage in the blood cell. And so we were just wondering whether is it something that we should take the stents out, and is it possible to, or the doctor do that, or what is suggested?
Okay. Well, Clara May, we do not take stents out, okay? And every time that a stent is placed in, we evaluate, are the risk of the stents worth the benefits? And the benefits is giving more blood flow to the heart so that the heart can do better and function better. Every stent placement has some risk. And the risk of the stents, it can damage the blood vessel, the endothelium. In very, very rare cases, the stents can have problems itself. So what we do is once a stent is placed, you'll go to your doctor. He'll make sure he's doing everything he can to keep the stent healthy, keep blood clots from forming. After it's put in, the first year, they usually put you on more blood thinners. There's many out there. There's aspirin, there's Plavix, there's Brilinta. They'll decide what is the best blood thinner for you, how long you need to take it, and then they'll monitor you for symptoms to see if the stent is malfunctioning. Sometimes that might be just asking you, are you having a symptom when you walk and do things? If you're not having a symptom, then chances are the stent is doing okay. Sometimes if they're not sure, they might order a stress test where you walk on a treadmill and they take pictures with a nuclear camera. And sometimes they'll have to go back in and do another test called an angiogram. And I actually brought, these are some materials that I brought with me today of the tubes that we thread up through the body to take pictures of the arteries to see if a person might have a problem with the stent. One of the things I want to encourage you is hopefully your doctor did not put this in unless it was indicated. Going to them on a regular basis, they will be able to tell you, Clara and Arthur, whether this is having a problem or not. So ask them, if you're not having a symptom, there's a good chance that the stent is doing well. And I hope that answered your question at least a little bit.
Thank you, Claire May and Dr.
Okay.
Janice, you have a question for Dr. Marcum. Go ahead. What do you have for us this evening?
Hello, Dr. Marcum.
Hi, Janice.
I'm calling in regards to Sjogren's syndrome. About 2 years ago, I found a lump in my neck, and I had it checked. I actually had an ultrasound test done on it, and I was told that my salivary gland had calcified, and the doctor attending at that time suspected that I might have Sjogren's syndrome. I had blood work tested at that time for Sjogren's, and it didn't show up. And at that time, I was also tested for diabetes and anything else that they suspected might be, and everything came back normal. Now I'm speaking 2 years later, and I still have the dry mouth, and I'm still tired very easily. And I was just wondering what you think it might be, and what do you suggest I can do besides drinking a lot of water? I also want to let you know that I have a family history. Both my father's parents died of stroke, and both my mother's parents died of colon and cancer.
Okay. Now, so the main symptoms you have right now is dry mouth?
Yes, and I've had that for 2 years. Any water that I drink, I just feel like it's just coating my tongue. I don't feel like it's really doing anything for me.
Okay. And now, how did they make the diagnosis that you might have Sjogren's a few years ago? Did they do a biopsy, or did they just say you might have it?
Well, they could tell, no, just from the actual ultrasound, but no, they didn't take a biopsy, but they did check, with the blood, and they checked with, I had my eyes checked and other things like that.
And what did what did they recommend that you do? Oh, man.
Well, believe it or not,
we're going to have to take her after break.
I don't recommend much other
Janice,
than,
if you could stay online.
And to drink a lot of water and...
Janice, you stay right there. We're going to be right back, and Dulcie will take your call when we get right back. Don't go anywhere.
The Heart of Health Live will return in just a moment.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Heartwise Ministries, and these adorable sheep. Want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. And Janice, you were on the line just before we went to break. Do we still have you there?
Yes, you do.
All right.
Janice, thank you. We have these commercial breaks, and sometimes I get carried away. But in your situation, what I would advise you, of course, you're doing the hydration, but you know, at this point, if I were your attending physician, I would start all over. I would go back into your doctor and get complete testing to make sure your thyroid's okay, a complete physical, look at all your symptoms, do some lab work, and then Sjogren's is a very tricky condition to diagnose. So I would get with your internist, get him to mention that you've had Sjogren's before, see if you can get a diagnosis on what you have. Then once you have the diagnosis and treatment can begin. In the meantime, we want you to do all the things to stay healthy, hydrate yourself, exercise, healthy diet, keep the mind healthy, all those good things. And I'm going to look for a specialist on Sjogren's in the future to see if we can bring them in to talk more about this subject. Because as a cardiologist, I don't deal a lot with this. But we will be praying for you, Janice, and just good luck on this condition.
Thank you, Janice. Dulcia, you have a question for Dr. Marcum. What is that?
You know, Dulcia is a very beautiful name.
It is.
I wonder if she's still on the phone. Dulcia?
Yes.
Oh, go ahead.
There you are. What is your question for Dr. Marcum?
I just want to know what is, I have this symptom for a while, maybe for about 8 years or more, but it never takes me to the hospital.
Okay.
And they call it a low-grade high blood pressure.
Okay.
But do I have to live that on for the rest of my life?
Well, you know, I assume that the blood pressure is causing your symptoms. And sometimes when blood pressure goes high, it can cause headaches, it can cause chest pain, it can cause the heart to malfunction. I would talk to your doctor about when you start feeling these symptoms about whether you need to take a medication. We've talked a lot about things that you can do to prevent blood pressure problems and things that you can do naturally to help, but some people do need a medicine. In patients in my practice like this that only get blood pressure problems occasionally, sometimes I give them a short-acting medicine to only take if they need it. Some people that have it high every day need a blood pressure medicine every day. So I think I would ask your doctor whether you need a short-acting blood pressure medicine to take when these spells occur. So we just want you to hope you start feeling better. And that name is very beautiful, Dulcia. Where are you calling us from?
I'm calling from Florida.
Florida, okay. Well, I don't think I've heard that name before, but that's a very beautiful name. We will say a prayer for you, but you ask your doctor if you might need a short-acting blood pressure medicine to keep you from having to go to the hospital as much, okay?
Thank you, Dulcia. Samuel, you have a question for Dr. Marcum. How can we help you?
Yes, ma'am. When I like walk, I try to exercise with like a slow walk, but on my left side, in my chest area. I get some very discomfort, and my doctors have done everything that they know, but they tell me that it is not my heart. So I'm wondering, what is it?
Yeah, well, you know, one of the things, if they're 100% sure it's not the heart. Now, sometimes I have to do an angiogram to prove it's not the heart. But if they're 100% sure it's not the heart, other things that can be is it can be related to the lungs. You could have a lung problem, and when you take deep breaths, it could hurt. It also could be related to muscles. So those are two other things. Sometimes I have to do lung scans on my patients that I can't do to make sure there's no clots in the lungs. But sometimes it could be a muscle. And if it's a muscle, hydration will help you. Sometimes relaxation will also help. But I would keep having them look for the cause. Something is causing this symptom. This symptom, Samuel, is not normal. So say, listen, what else could it be? And then have them do some more testing. At least give you a diagnosis. If you know that it's a muscle for sure, then you might approach that differently than if you thought that was your lungs. So we just hope you find out what's causing it and give us a call back again and let us know how it's going, okay?
Drink more water, something like that would help maybe?
I think that would help, because if it's a muscle, 70% of the muscle's water. If you hydrate the muscle, sometimes it does better. You know, the athletes, if they have hamstring problems because they don't hydrate them, they have cramps. Sometimes the muscles in the chest and the intercostal muscles along the ribs can have that same type of feeling. Also, make sure you get your electrolytes, your potassium, magnesium, those type of things will help as well. So thanks for calling, Samuel.
Okay, doctor. I think, and that's what a doctor said to the that I might have. Muscle problems there. You know.
Good. Samuel, thank you so much for your call. And right now, Dr. Marcum, we're going to take care of a couple of these text messages that are coming in. This person states that her husband is young, 46, very young nowadays. Almost vegan, has a physical job where he does get a lot of exercise, but when he takes his blood pressure, he has an irregular pulse, and she's wondering if there's something that she needs to worry about that.
Yeah, if the pulse is causing a symptom and it's persistent, I would get it checked out. Lots of people have skipped beats that are benign. But if a person's having a symptom, they're passing out, they're dizzy, it's happening all the time, I would get it checked out. But if it's just a skip and there's no symptoms, he's active, doing everything, I wouldn't worry too much about that.
Great, thank you so much. And I have another one here for you. A little over a year ago, this person, postpartum, meaning they just had a child, had a mitral valve that they were told was just a little bit thickened due to a history of rheumatic fever. She doesn't like the penicillin antibiotic therapy that was recommended and is wondering if there's some natural treatments that she can do. She's only 35, so she's wondering what her alternatives might be.
Well, the reason they want to give her this medicine is because a valve that's been damaged is more likely to pick up an infection. Okay, you're giving birth, that's not a clean type of situation. Also, teeth. If she were to have an infection, usually it's a bacteria that got in the bloodstream and got on the valve. It could and a damaged valve is more likely to pick it up. If it got on that valve, it could hurt the valve.
Now, what's that have to do with her teeth? You
mentioned well, the teeth, you can have some bleeding, bad dentition, bad gums.
When someone cleans your teeth, for example?
Yes, cleans your teeth, exactly. So if any break in the skin could introduce a bacterial pathogen. If it gets in the bloodstream, a normal, it might not even stick to a valve, but when a valve has been damaged, especially a myxomatous valve, that means a damaged heart valve, it's more likely than most to get an infection. There's no natural substance that helps with that. So penicillin, if you're allergic to penicillin, erythromycin, those are some medicines we use, but there's no alternatives other than those that are out there.
Okay, thank you. I have another one here for you, Dr. Marcum. This person says you talked about symptoms that occurred with exertion when they were working out. What about being awakened at night due to a rapid heartbeat? What are your thoughts?
Yeah, now that could be many different things, and I see that a lot. Sometimes that could be a condition called sleep apnea, where you don't get enough oxygen at night and your heart starts to race. Sometimes it might be caused because you have a bad dream or you have stress that's going on in your subconscious and it gets you up and you get startled and get scared. So if it's happening frequently, we can put a monitor on a person. We can see if they might have sleep apnea. There's testing, we can do that. But if it just happens occasionally and everything else is okay, they're walking, they're exercising, no other symptoms, if it just rarely happens, I wouldn't worry. How old is this person, they say?
You know what? They did not say.
Yeah.
Did not say the age, no.
And younger people, I'm not as concerned. As we get older, all the parts get older. I would be more aggressive in an older person, but in a younger person that it happens on, I wouldn't do a whole lot.
Okay, would you recommend that they follow up with their physician?
Yes, always. If they're concerned about it, get an expert opinion and go over all the details.
Absolutely. We want to thank you for your text messages. Also want to thank you for your calls. We do have several that we want to get to just after this break. I would like to remind you what that telephone number is if you want to call in, 855-644-3278, and to text 423-834-7307. We'll be right back.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Thank you. It's good to be with you tonight. We have a special guest here with us, Dr. Marcum, who's here talking about cardiology, from prevention in cardiology to answering any question you may have. Right now we have Jean, who's on waiting for us with the call. Jean, what question do you have for Dr. Marcum?
I want to find out if by losing weight you can reverse diabetes.
Okay. That is a great question, Jean. Type 2 diabetes, okay, or adult onset diabetes, is a disease that's caused by too much fat. Too much fat in the body, too much fat in the diet. The fat cells, the cells get full of fat and the glucose can't get in. It hurts our insulin receptors, they regulate up. So yes, if you, it's not over 90% of people, if they eliminate fat from their diet and fat for the body, if they have type 2 diabetes, can eliminate this disease. Dr. McDougall in California has some great information. If you want some more information on this, I invite you to go to the website pcrm.org, pcrm.org. That's Physicians Committee for Responsible Medicine.org, and this will help give you a plan and some more details. But that is a great question, Jean, and thank you for calling us this evening.
Thank you, Jean. I have a couple other questions for people who've called in. This person says they have darkness in their stools. Why is that, and what are some possible causes?
Yeah, darkness in the stool, a couple things that I worry about is bleeding in the GI tract. I guess that would get me concerned about the most. Other things that can cause it, believe it or not, iron, if they're taking supplemental iron in their diet, can cause it, and certain food and preservatives can cause it. But the thing I would worry most about is bleeding. Your doctor can do a test to see if you're bleeding. It's a stool test, or he can do a bigger test if they need to, but I would get that checked out just to make sure you're doing okay from that. Great question.
You know, we had a person calling from New Zealand.
New Zealand,
New
wow.
Zealand, with several different issues. If you could just touch on a few in our last few minutes here. They've been having some marriage problems. There's a little bit of depression. They've had shoulder pain, some bowel problems, circulation problems, arm pain, fingers, and numbness in the feet. They're 3 years medical drug free. Do you have any advice for some of these symptoms for our caller from New Zealand?
Okay. Well, that's a question. A lot of people have all sorts of symptoms that we can't explain, but one of the things I would want to make sure is that you don't have a lot of these symptoms that's causing by stress in your life. We know that any type of marital stress, relationship stress, worries, that can cause adrenaline in the body. Adrenaline and cortisol and these inflammatory cytokines can cause extra symptoms. So we want you to be as stress-free as we can. You know, I would definitely see your doctor, get a complete physical. Make sure you're doing things that lower your stress, like deep breathing, exercise. Worship actually lowers your stress. Having a relationship with God, music, things like that. Add that to the regimen. Make sure you're drinking enough water, eating food, and avoiding things that cause stress in the body. You know, we're almost all out of time here.
We are, but it has definitely been a pleasure being with all of you. We are giving out Dr. Marcum's book, The Ultimate Prescription, to one of our text message people, and this is going to go to the person who texted in regarding her husband, gets lots of exercise, and has an irregular heartbeat when he checks his blood pressure. So congratulations. And we are so happy you were with us tonight. Please join us again next week. Bring your questions with you. You can join us on Facebook at Heart Ministries, and you can join us online and ask your questions there as well. Thank you and have a great evening.